Native American Health Services has been in the hospital for a long time, and they've always had an outreach component. So with Native American Health Services, we started to do more outreach with the Pueblos. In every single listening session that we had last year, we heard that language access was a need, and culturally informed care was something that Native people really wanted to see more of in the hospital. We've been doing interpreter training for years. The Zuni tribe is the largest Pueblo in New Mexico, so we decided to start with them.
Language is unique, we all used to evolve as one, being departed from one another. A little bit of language, religion changes through all these pueblos here.
We got this started here in Zuni, and Alicia was our first student.
We deeply appreciate your commitment to supporting Indigenous communities' healthcare needs.
This is, we think, the first type of this type of training that has actually taken place in America for training Native Americans to become qualified medical interpreters.
We didn't know there was like a guidelines.
So it's like a whole different other thing compared to what we're used to just going in and talking.
A medical interpreter basically has to have knowledge about a code of ethics that medical interpreters need to follow, and also their fluency in medical terminology.
What we learned is that Zuni is a descriptive language, so we don't have actual terms to some items and whatnot, so we have to kind of best describe it in a sense it makes sense, if that makes sense at all.
Typically we think about sugar. Sugar levels in blood are high. Okay, so when you're speaking with a Zuni-speaking patient, the only thing that they know about sugar is that white powder that you use on the table, right, adding it to foods. So when you tell them that the sugar is high in their blood, then they may be thinking about that white powder, which is not necessarily what is high in their blood. So that creates a communication barrier.
One thing that was really helpful about this training was everybody who was trained works in the hospital. So, they know medical terminology, they know how hospitals and clinics work. It's the first time we took this out into the community, and this was our first Pueblo partnership, and we hope it's not the last, but one of many.
The graduates that have finished this course, they are the ones who have stepped up from our hospital, who were willing to take on this challenge.
We are very thankful for this service. It's really needed among our people.
We love our community and give back to the community that helped raise us. We learned just to keep the language, to pass on the language so we carry it forth through future generations.
So we still retain our original language. It's never gonna disappear from us. We know where we come from, we know the stories.
This pottery I had my nephew make for the University of New Mexico Language Services Department, and he actually went ahead and put a stethoscope up there too.
It's great as a New Mexican to give back to communities, especially communities that I'm not a part of, but we know that New Mexico has a really beautiful diversity, and to be able to do some small thing to give back to another community means a lot.